Good afternoon, everyone, and welcome to the Coordinated School Health webinar. I'm Michelle Smith. I'm the director of the Southern Obesity Summit and the Southern Obesity Prevention Strategies, and we're excited to have so many people registered for this webinar today. Just a few little housekeeping things. You should have a control panel that will allow you to ask questions. All you need to do is type the question in. We won't be opening the phone lines because we had over 200 people registered for the webinar. So if you'll just type your questions in, we will be monitoring the questions and we will answer all those questions at the end of the presentations. We have three great presenters today. We're real excited. We have Kathy Payne from Oklahoma, and they have a wonderful program up there that recognizes schools and rewards them for implementing coordinated school health programs. And then we have Rebecca Johns-Wommack from Tennessee, and they have the only coordinated school health program that's mandatory and is funded. So she's going to share information on how that has worked for them in Oklahoma. And then we have Lang, Ray Langlois. Ray, I always butcher your name.
That's
He,
okay,
he's
Langlois.
he's from here in Texas and has a lot of experience with working with schools on implementing coordinated school health and the things that can help us put some accountability at the campus level. So I don't want to take up too much more of their time. I want to give everybody as much time as possible. Um, we will send out an evaluation after the webinars so that you can let us know what you liked, what you didn't like, what you'd like to see next. There will hopefully be some additional webinars on different topics that we're working on through the Southern Obesity Prevention Strategy. And I believe when you registered, you were asked if you were interested in joining the school work group. If you are and you didn't check it off on your registration, you can always email me, and my email is on that last slide. So let's just go ahead and get started with our program, and we will let Kathy take us in on Oklahoma.
Okay, thank you, Michelle, and thank you. I'm honored to be part of this webinar today. And thank all of the participants for giving their Friday afternoon at the beginning of a long weekend. So appreciate your presence today. Let me just tell you a little bit about our state of Oklahoma. As you already know, we sit in the middle of Tornado Alley, and as indicated all over the news this last week, we certainly have once again been facing a tremendous challenge of putting a community back together, literally from the ground up. But I think you also hear about Okies. We're pretty resilient, and we'll get back on our feet. Oklahoma has a population of 3.8 million people, and we live in one of 77 counties. Tulsa and Oklahoma City are the two largest metropolitan areas, and Oklahoma is mainly a rural state. We have 666,000 public school students enrolled in over 500 school districts across the state. So next slide, you can see, next slide there, yeah. You can see that we're in the south central part of the United States. We're the only state that has never had a health education mandate. I think Texas did at one time, and then I think they don't have one going on now, but we certainly have tried to get a health education mandate. In fact, our child advocates have tried for about the last dozen years, and we haven't been too successful, really, until the last few years. We couldn't even get the conversation started about the connection between health and academic achievement. But our new Certified Healthy Schools program is really changing that conversation. So let me give you a little snapshot of our state. Unfortunately, we have some pretty dismal health statistics, and so these health statistics are helping to change the conversation. We're 43rd in overall health, as you can see, but that's an improvement from our 2011 rankings where we were 46th. We're 40th in youth smoking and 42nd in youth obesity and 46th in teen births, and suicide is the second leading cause of death for teens in Oklahoma. And even though there are multiple health initiatives in our state, we've only made incremental improvements in our health outcomes. And though advocacy efforts continue for health education, we've not been able to make health education a requirement. But what we have been able to do is to build on a successful program that has been around since 2003, and it's called Certified Healthy Business. So I know I'm supposed to talk to you about schools, and I want to do that, but I want to tell you how the Certified Healthy Schools program originated by telling you a little bit about Certified Healthy Business. And in 2003, a group of innovative partners from the Oklahoma Turning Point Council and the State Chamber and the Academy for State Goals and the State Health Department developed a certification program to improve employee health, and it was called the Certified Healthy Business Program. The goal was to promote wellness in the workplace, and the founding partners developed criteria for this business certification, and the objective was to challenge businesses to develop policies and programs that would impact the health of employees and create healthier places to work. Next slide. So through grassroots efforts, the certification program was promoted around the state, and businesses of all sizes began applying. A scoring tool ranks businesses who meet certain requirements, and the business then is either awarded a basic merit or excellence status depending on the number of health policies and practices that they have in place. And to date, over 1,100 Oklahoma businesses have been certified. Points are given for programs like tobacco cessation, weight management, healthy cafeteria options, businesses that give health breaks or health screenings, and policies like having a tobacco-free workplace. So the Certified Healthy Business Program was so successful that the same kind of certification program was created for restaurants and college campuses. And then in 2010, a health champion in the Oklahoma legislature created the Certified Healthy Schools and Certified Healthy Communities Act. And they directed an advisory board and the State Health Department to establish and maintain a school health certification and a community health certification. And the legislature based the criteria for this new certification program on the Center for Disease Control's Coordinated School Health Model: health education, physical education, health services, nutrition services, counseling and support services, a healthy school environment, health promotion for staff, and family and community involvement. And to become a certified healthy school, a school, just like the businesses, would have to meet a certain number of requirements in each of these 8 components of coordinated school health. So an advisory committee began to study the 8 school health components and developed 8 to 10 sub-criteria that thoroughly defined each of these 8 components of coordinated school health. So now I'll show you in just a minute some examples of criteria that the advisory committee developed under each of those components. The slides that you'll see in a minute just really represent only about a third of the actual criteria that is listed in the application. Schools apply for certification through a designated website, and I think I had that website up for you to see. Once they're on the website, once they go to the Turning Point website there, the first thing they'll see is a set of guidelines for completing the application. The guidelines will tell them how to complete the online application. And before schools apply, they must be in compliance with existing federal policy on school wellness and the Oklahoma State mandates that pertain to the health of a school and the health of its students. So let me show you a little bit of the criteria under each of those 8 components, and we'll start with health education. I just picked out these 3. I thought maybe you might have an interest in these. I'm sure you have an interest in all of them once you get online and see the application itself, but this is part of the criteria. Whoever is filling out this application for the school is looking at this on a SurveyMonkey. The school must be implementing health education curriculum following the National Health Education Standards. The school must be providing professional development in health education for its teachers. And we want the school to be using the health education curriculum analysis tool to assess and evaluate their health education curriculum. Under physical education, the school does not use physical activity as punishment. In fact, the IOM, I guess, as you all know, just came out with a statement on that recently. So we're glad that we have that on as part of our criteria. Another criteria under physical education is that we'd like the schools to use a physical education analysis tool to assess and evaluate their physical education programs and curriculum. And we'd like to see 150 minutes weekly of physical activity for grades kindergarten through the 5th grade. In health services, and next slide.
Yeah, sorry.
The school must be in compliance with state immunization requirements. We really promote that they hire a full-time school nurse. And also the school can get points if they have a tobacco prevention or cessation program for students or staff. Under nutrition services,
sorry.
One back, that's okay. Under nutrition services, and again, I'm only showing you just a few from each of the components. You can't see the picture at the bottom right-hand corner of the screen. I don't know, maybe you can see it very well. I'm not sure I can here, but this is a group of Oklahoma elementary children who've piled up a lot of candy over a period of time, so you can probably guess what that nutrition lesson was all about. I thought that was a great picture. But you know what? Their faces don't look very happy to me. I don't know what you're seeing, but their faces sure don't look happy to give that candy up. But that's what the lesson was about. So some of the criteria: only healthy food and beverage options are available on the school campus, including snacks in the classroom, vending machines, school stores, and competitive foods sold in the school cafeteria. Another piece of criteria: only healthy foods or non-food items, such as wrapping paper and T-shirts or plants, are used for fundraisers. And the school participates in the USDA Farm to School program. And I know for some schools that's a real challenge, but we certainly are promoting that in our rural state. The next one is counseling, psychological, and social services. And 3 criteria listed under this component. We want the school to have guidelines for identifying, referring, and following up students who need social, emotional, behavioral, or mental health services. We want the school to provide suicide prevention and awareness training for students and staff and parents and guardians. And we'd like to see an active peer mediation program. And let me just go back to say that a group of experts really in all of these areas came together to create this criteria. It is by no means exhaustive of each of these components, but we spend a lot of time looking at what ideally should be under these different components. So the next slide: healthy and safe school environment. We'd like to see that the school uses the School Health Index. In fact, we are promoting this so much in the state. Last week, the CDC came in and did a training of trainers. So for those folks who are viewing this presentation, we now have a whole cadre of School Health Index trainers who would be available to help your school learn how to implement the School Health Index. So again, schools receive a point if they are utilizing this tool. Another criteria: bullying prevention policies and programs are available to parents, and policies and enforcement of 24/7 tobacco, alcohol, and drug-free campus. There's a policy for all those, and the policy is enforced. Health promotion for staff. Under health promotion for staff, we'd like to see that the school providing annual voluntary health screenings for the staff. We'd like to see the school providing nutrition education and weight management programs for staff. And we want to see at least 5% of the school staff that has a current certification in CPR and first aid, and also the use of automatic defibrillators, automatic external defibrillators. Other criteria that you don't see under this is, we want the school to provide stress management programs for staff. And we want the school to offer physical activity opportunities to staff before or after school. And there's a lot more to mention, but again, not enough time. Under family and community involvement, and this is the final component of coordinated school health, some criteria include that we'd like to see the school provide space for a community garden. And the ones that you're looking at, this is from a community garden in Muskogee, Oklahoma. On the left-hand side, you see some ornamental and hot peppers, and on the right-hand side, you see some spinach, onions, tomatoes, and squash, and you may even be able to see the arbor there that has pole beans attached. We'd also like to see the school provide health fairs that include voluntary health screenings, immunizations, and referrals. And we would like the school to have school and community shared use land agreements. So this is just a snapshot again of our criteria. You can view the entire criteria by going online to the Turning Point website. So let's talk just for a minute about applying for this certification. When a school decides to apply, again, they'll go to that Turning Point website and they'll see a drop-down box. And the drop-down box will have all 5 certification programs, all 5 Oklahoma certification programs listed: business, restaurant, college campuses and career techs, communities, and then the certified healthy schools. So they'll click on the schools box, and when that screen comes up, you'll see guidelines for applying to become a certified healthy school. And we want the school to read through those guidelines and determine their eligibility to apply. And once they determine that they can apply, then they use the online application, which can be done in about 30 minutes. We really strongly recommend that if an Oklahoma school is going to apply to be certified, that a team of people sit down and look at that application together, and that, most importantly, that the school principal signs off on it. So certified healthy scoring and awards. Scoring to become a certified healthy school is based on a standard formula that was set by the Oklahoma legislature. A school that meets 2 criteria in each of the 8 components of coordinated school health receives a basic certification. A school that meets at least 3 criteria in each of the components receives a merit certification, and a school that meets 4 criteria in each of the 8 components of coordinated school health receives excellence. And then all awardees are invited to a luncheon and award ceremony, and this includes the winners from all 5 certification programs. This past February, we welcomed over 900 people to our annual Certified Healthy Oklahoma Awards. And the winners are, let me show you a little bit about this one. Next slide. In 2011 was the first year for the Certified Healthy Schools Award. 207 schools applied and 155 received certification. And in 2012, we doubled that. 431 schools applied and 314 were certified. Those who received excellence certification were honored with a trophy. Those who received basic and merit received a certificate and a lunch and a wonderful speaker. And there's more. And so the next slide talks about the Healthy Schools Incentive Grants. Once a school site receives certification, the school district then has the opportunity to apply for a Healthy Schools Incentive Grant Award. Now, this award is funded by the Oklahoma Tobacco Settlement Endowment Trust, TSET. To be eligible for the Healthy Schools Incentive Grant, school districts must ensure that at least half of their school sites have been awarded the Certified Healthy School status. If 50% of the schools in a district receive certification, then the district may apply for the grant award from TSET. The grants are designed to incentivize school districts to implement policies that will encourage students and faculty and staff to eat better and move more and be tobacco-free. Monetary awards are based on the size of the school district, and funding ranges from $500 to $150,000. And this year, 26 schools received a total of $189,000. School districts are using these incentive grants to make playground improvements and purchase health education curriculum and complete walking trails and purchase AEDs, build school gardens. So you can see that the Certified Healthy Schools certification and the possibility of receiving an incentive grant is a great combination to promote coordinated school health in our state. So that's about all I have right now. I thank you for listening, and I'll be here to answer questions in a bit.
Thanks so much, Kathy. That was a fabulous presentation. I have a couple of questions, but we're going to hold the questions until after all of our presenters have had an opportunity to present, and then we will go through the questions. So we appreciate it, and we will bring up Rebecca and have her tell you a little bit about how things have worked in Tennessee.
Yes, good afternoon. I'm going to be talking to you all a little bit about not paving the way, but how you pay the way for coordinated school health and how Tennessee has succeeded in funding and sustaining its program, and I'm going to share our story with you. Our next slide, please. Our objectives today are very easy. We're going to go over what the coordinated school health model looks like in Tennessee, how we apply it to the state of Tennessee. I'm going to share with you kind of how we got to be where we are today and share some of our coordinated school health successes and progress. So, little test. What is you can click it again, please. What is the only state in the entire nation that has a legislative mandate and state funding to implement coordinated school health in all school systems statewide? Click it again, please. Ta-da! The state of Tennessee. And we have 136 school districts here, and we have state funding that is in reoccurring funds for the entire state for the sole purpose of coordinated school health. And I'm talking to you all this way in that in no way is it an arrogant thing whatsoever. We're about sharing the knowledge, and hopefully we have not only paid the way, but we're also paving the way to able to assist other states. And if anybody can learn from our successes and our faults and what barriers we've occurred to help you in your states, then hopefully we're helping others, and we are here to help. And by the way, this is Dr. Hal Wexler's slide that I borrowed from him, so I want to make sure if he sees it that he understands I'm giving him credit. So I'll talk to you all a little bit about what works for us. Next slide. The top part, the green part, is the coordinated school health model. It's the same model, the good old CDC model that is tried and true from the CDC in 1987. It's the same model that Kathy showed, and we know that this is a holistic model. It is child-centered. That's why you always see the children at the center, not building-centered. And it is truly, and we have experienced this in the state of Tennessee, it truly is a seamless model of support for a child, because we know that healthy children grow up to become healthy adults, and healthy children also learn better, which is one of this model occurring in our schools is a way to reach the maximum amount of Tennesseans and the maximum amount of Americans, and then you end up bringing the parents and the communities into the school, and that's why, obviously they're involved in the 8 components. But I want to focus on the blue part and the red part, and that's where this is a little different in the state of Tennessee. And at the state level, you see the blue part. I mean, the base and foundation of our model obviously is the law. We do have a law that supports what we're doing, and it is bipartisan. It's not a Democratic or Republican thing. This funding was truly bipartisan. We are housed in the Department of Education, which is a really good fit, and we understand schools. And there's a trust there with the school systems by us being housed in the Department of Education. But what's wonderful is we are then able to connect our other state partners, like the Department of Mental Health, our wonderful partners like the Department of Health, universities. We're then able to link them into the schools from the state level. This red part, ladies and gentlemen, truly is what makes coordinated school health successful in the state of Tennessee, and it is the coordinator. Our funding funds a coordinator in every single school district, all 136 school districts, and their sole job is to work on all 8 of those components for their school district. That's the only thing that they do. So they coordinate. They truly coordinate all 8 of those components. So that's when you truly start seeing the synergy working from the model. It is the coordinator. They are hired locally. They're not hired by the Department of Education. They're hired locally. So you have the coordinators that truly know their strengths and weaknesses from their school districts. They also know the strengths and weaknesses because they conduct the school health index in every single school. And so they are able to link the weaknesses to the resources to overcome those weaknesses. So that's what's so wonderful is you've got this coordinator that's able to link the resources of Action for Healthy Kids or Alliance for Healthier Generation or the local community resources truly to the need. So that's what they do is coordinate. And you'll hear me say that a couple of times, that they are so key to our sustainability. So let's look at the benefits of coordinated school health. And these are truly the benefits that we have seen in the state of Tennessee because of having a coordinator in every school district, because we have the coordinated school health mandate. We truly have seen an increased effectiveness of each component. There's the synergy that we talked about of everybody working together, and this is true of coordinated school health. It truly is holistic. It's a focus on not just the physical, but the mental, the emotional, the social, the intellectual. It helps to reduce duplication and fragmentation. It's that coordinator pulling all the resources together, everybody at the table, and everybody putting their resources together for the common goal of helping children. It also links to community resources. You know, so many times in the schools, nobody has time to go out and get the community resources and link the community in the schools, and that is the role of the coordinator. Also, the benefits of coordinated school health is linking what we do with academics. And we know that having all of these things in place is a greater likelihood for sustainability. And that's obviously our goal is to sustain. You know, we don't want to bring in just one-hit wonders in the school systems. We know that doesn't work. We want to link to education. We truly are working to change the school infrastructure to the coordinated school health model where everybody's truly working together. And what's important is where we are working now is working for the schools to take ownership of coordinated school health. So once the coordinator gets everything up and running, they teach the healthy school team leaders to take ownership, and the schools take ownership of the work that is going on. So how did we get here? Real quick, our story, how we got to with the coordinated school health legislation. Ladies and gentlemen, this all happened with the vision of one person in the state of Tennessee. And I tell you that to try to empower anybody out there, no matter what roadblocks that you see, that it can be done. It was a school nurse by the name of Connie Givens, and she lit up a grassroots effort in the state of Tennessee. And her husband actually had to be was a state representative at the time, and they pulled together university people. They pulled together political powerhouses. They pulled together parents, any and everybody. They got together with their task forces, and they truly lit a grassroots effort. And they talked our legislators into funding in 1999, give $1 million. We know that $1 million across the state of Tennessee wouldn't have gone very far, but they talked them into just funding 10 pilot sites, and that the coordinated school health law went into effect in 1999 to fund 10 pilot sites across the state. And the standard and guidelines were written and approved by the Tennessee Board of Education in 2001. The 10 pilot sites were up and running. And then what happened is 5 years later, they went back and looked at the data from those pilot sites after 5 years, and the results were in 2006, because those children truly did better academically. Their graduation rates were better. The kids were healthier. Our legislature expanded the law statewide and now funds $15 million, and that law went into effect in 2006. And at the same time, they created a 90-minute physical activity law that mandates physical activity 90 minutes per week for every student K through 12. And our coordinators also help the implementation of that law as well. So next slide, you can see the specific role from the state. We are very, very busy here. We do a lot of monitoring because it's really important that the coordinated school health funds be spent on coordinated school health, and that our state funds are spent very wisely. So you can read there that we do a lot of monitoring here at the State Department. They have a huge application for them to get their funding every year that they have to report to us with their budgets. We go over their budgets. We go over, they have to submit district action plans and SMART objectives to us. And so we do a lot of following up. We work on partnerships. We try to stay up to date on best practices, whatever professional development that our coordinators need to be able to assist them. Next slide, please. What do we monitor? Let's look at the role of the coordinator, and this is a question that we get very, very often. First of all, the coordinator has to be full-time. They can't be teaching and also coordinator. Being a coordinator is their full-time position. Every school district is required to have a SHAC. They are required to have staff coordinating councils, and a lot of times the SHAC and the staff coordinating councils are the same. Each school is required to have a healthy school team. That healthy school team is required, I know that Kathy talked about this, is all required to conduct the school health index, and then that's where they form their own individual action plans from. They are required to bring in community resources. They're required for staff development, and they're required for evaluation. Here in the state of Tennessee, we collect BMIs, vision, blood pressure, and hearing on every child in grades K, 2, 4, 6, 8, and 1 grade of high school. And then also there's a lot of evaluation in that application that is submitted to us, so we can monitor how coordinated school health is indeed working. So again, this is what truly helps these schools take ownership of coordinated school health. So the next slide, the top priorities, first and foremost, reduce the childhood obesity rate, and the coordinators are required to primarily concentrate on physical activity, healthy eating, and increased comprehensive health education. And we know these go hand in hand with academics, and that's done through physical education, done through health education, and also integrating physical activity and health education into core subjects such as Common Core. We have seen a 2% decrease in our BMI rates. Right now where we are is we have leveled off, which is wonderful. We're not increasing anymore because we were one of the worst for our BMIs. And we will have the data for the Obesity Summit that I'm really excited about. Right now, we are beginning to look at what counties have significantly dropped their obesity rates because of coordinated school health, and we can kind of look at some common denominators of why that's happening. So real quick, I know we're running out of time for me. If you look at the Tennessee school health progress, well, let's just flip through this. Here's some of our successes, y'all, that wouldn't have occurred without coordinated school health here. We see now that the coordinators worked hard to align their work, and with the race to the top, which we call First to the Top in the state of Tennessee, we see now more health goals are being worked into those plans. This is an amazing celebration. Since 2006, our coordinators have brought in an additional $73 million in writing grants and in-kind resources just by having that coordinator, and that goes 100% back into the schools because they are required to write grants. Next slide. All schools, we have active healthy school teams, and that's where we look at that success. And then we see that 82% of all of our school districts in just 2011-2012 alone have strengthened or developed new health district policies and procedures, and they are constantly updating their wellness plans. Next slide. This is a celebration as well. You see how many student referrals from those screenings were made, and these are students that would not have been referred to a healthcare provider for the care that they need, and these are health issues that were brought up in our health screenings. And we also see health clinics where children are being seen and treated right there in the school and returning back to class, whereas they would have missed class. We see that there's a 75% increase in our school-based health clinics since the beginning of coordinated school health. Oops. And then we see here that we see 84% of our schools are in compliance with the 90 minutes of physical activity, and we report that to our legislature. Almost 289 schools now have walking tracks or trails that have been built just from having the coordinator. Next slide, that's fine. Y'all, we've gone from being one of the worst in the area of nutrition to one of the best, and you can see here that we have increased from 26% of schools that did not sell or that sold unhealthy items to actually being one of the best, and 78% that do not sell soda or fruit juices that are not healthy. And you see that our vending law is going really, really well, and you can see the decrease there. Next slide. I'll bring this to a close. So the bottom line is, it is the power of partnerships. It's not just about the Department of Education. It's not just about coordinated school health. It's all of us working together for coordinated school health. And this is a quote from Connie Givens. That was her favorite quote from Margaret Mead, that truly one person, a few people in a state can make a difference, and we are testimony to that. It's all about the kids.
Oh, yeah.
There's our contacts.
Awesome. Those
All
are,
right, there you go, Ray.
That is very exciting information, Rebecca. I'm so happy to hear your success. It gives all of us in the other states confidence that we can continue to move forward on coordinated.
Yes, we see it.
We are very excited to see that. And we have some questions for you, but we will hold those. If you have questions you'd like to ask, go ahead and please enter them in the question box, and we will get those here at the end of this, after our last presentation. And our last but not least person, Ray, is going to share information about how to get coordinated school health at the campus level and ensure that it actually gets implemented and is effective. So let me see, Ray. Let me unmute you, and you might be able to talk now. There you go.
Hi there, I'm unmuted now. Good afternoon, everyone. I'm truly impressed with the things that are going on in Oklahoma and Tennessee, and I'm also honored to represent Texas today in the Leander Independent School District. Today I'd like to share a few slides with you addressing adding accountability for implementing coordinated school health in the elementary and middle school, junior high campuses in Texas. First, I'd like to say, you know, when you're talking about accountability and the health of children, this can be achieved if schools and districts do the right things for children. Otherwise, you're going to have to put some laws, policies, and et cetera in place to hold people accountable. And we've seen this in Texas, and we've seen this model work well for us. In Texas, our model for coordinated school health is the same as the other two states, using the CDC model. But what's important to us, and one of the focuses we have in our district, is that all 8 components are about educating the whole child. So we've moved past just nutrition, health, physical education services, but we're now adding collaboratives of with parents and local community members as well. Next slide. In Texas, the law requires through the Texas Education Code that coordinated school health programs be used in all school districts. And this program should primarily focus on the areas of health education, physical activities, and parental involvement. Next slide. So this process just didn't happen overnight. In fact, it just like in Tennessee, it took several years to evolve to what we have now. And it's important to look at that evolution to understand why the accountability component was important piece of legislation. In 2001, our shacks school health advisory councils were required, and the coordinated school health had to be implemented in all of our elementary schools by 2007. Then our legislature meets every 2 years. So in 2003, the composition of the SHAC membership was established. SHACs were given an authority to make recommendations about coordinated school health programs. Next slide. In 2005, the coordinated school health program expanded to include middle school or junior high schools. And in 2007, our state adopted a physical fitness assessment, and a lot of our school districts use the fitness gram, and some of you might be familiar with that. But in 2009, this is when things took a turn for accountability, and the legislatures expanded the requirement of elementary and middle school, junior high campuses to include in the campus improvement plan the development of goals and objectives for the coordinated school health program on the campus, and they based that on certain criteria: fitness data assessment, academic performance, student attendance rate, percentage of social economic status, the use of physical activity, MVPA, and recommendations from SHAC. And just a comment here, the schools were already had in place an academic campus improvement plan, and through some of the data collected by Austin ISD, Michael and Susan Dell Foundation, and TEA, Texas Education Agency, they found some strong links with the way we were collecting data and academics. And so that gave us an opportunity to hook in to the campus improvement plan, which is an important function for principals to go through every year. Next slide, please. So what should you have in your campus improvement plan that's related to coordinated school health program? And so the next couple of slides, what I'd like to show you is kind of how that example would look here in Leander. So and just to go back to one other thing, one of the reasons that this became important in the area of accountability is it formalized some documentation that schools were actually implementing a program. There's one thing to say you're implementing a program, but to have that written down, documented, and then assessed later became really important. So in the first area, you had to identify your coordinated school health program. So our example would be at Leander Middle School is implementing CATCH as our designated coordinated school health program, and it's implemented through the areas of wellness teams, family fitness night, nutritional programs, and intramural running club. Next slide. What goals and strategies are stated in the SIP? And that's what we call it here, the SIP. At Leander Middle School, our goal is to improve diabetes prevention awareness by participating in Healthy Kids, Healthy Family program. Next slide. So the next slide. There you go. So cite your resources that you reviewed prior to developing goals and strategies. And when we targeted the population of Leander Middle School for the Healthy Kids, Healthy Families program, we looked at some of their criteria, including fitnessgram data, academic data, student populations, and also community health data. And Leander Middle School had strong indicators for need of diabetes prevention awareness. Next slide. So how does your how are you ensuring PE class time has 50% moderate to vigorous activity? Well, what we did at Leander Middle School to decide to do this was we implemented circuit training twice weekly to improve the students' access to fitness training. And we already have a running program in place, so this became a really good complement to the running program. Next slide, please. So this is a template that we used, and I know many of the districts in Texas have a template, an action plan template that goes with their SIP. And if you look at the top, of course, we have the title, Coordinated School Health, or CATCH Action Plan. We use that nomenclature because we find our principals, you know, when we tell them it's the CATCH plan, they get it right away. We put our goal up there and that's our district goal, to create a sustainable coordinated school health system that provides wellness tools and resources that leads to balanced, optimized lifestyle for all students. And then we use an action plan format, and this is the same format that we use for all of our academic objectives as well, and that makes it, it creates that formalization that we were looking for. So we have the objective, the strategies, who's going to be responsible for implementing strategies, what measures, and what is a realistic timeline in implementing this. Next slide, please. Also, something else that can be considered in a campus improvement plan, and our SHAC also works on a district-wide strategic plan, and sometimes they'll target activities for elementary or middle schools. But some things that you can look at would be any recommendations from your SHAC, and how could you implement that at the school level. So such as examples as policies regarding food as fundraising, physical activity and behavior management strategies. What are your policies related to that? Joint use agreements on indoor and outdoor space, guidelines for alternatives to food as incentives, ways to increase parent engagement in healthy lifestyles. Next slide, please. So what are you trying to do here? So, well, what you're trying to do is develop a sustainable document that you can use in your campus wellness teams. And what we do is our campus wellness teams start with this document, and then they develop their wellness team strategic plan. So they'll drill a little bit deeper from the district-wide plan. And then also this plan is good as a guiding tool for your SHAC, and it allows your SHAC to go through an improvement process as well. So in Leander ISD, and I know a lot of you use some kind of strategic planning process or improvement planning process, and here are the components of the ones that we use. First, we focus on data. Secondly, we address areas of concern. Third, implement a strategic plan. Fourth, review, reflect on results. And then lastly, but not leastly, monitor, monitor, monitor. And I say this because I think that when it comes to monitoring, one of the things that you have to keep in mind is that anything that is not monitored becomes optional in a school. So you have to decide who is going to monitor that the plan actually gets implemented. And we use kind of like they were saying in Tennessee, we use a very similar structure. We have a district-wide coordinator that monitors that all of this is done within the district, and then we have wellness champions on each campus that monitors that the plan is actually implemented on the campus. And then our SHAC does as well by their annual data review. So next slide. So where do you find resources? If you're looking for resources to find out about accountability of coordinated school health and campus improvement plans, here these are the websites that I would look on: the Texas Education Agency, the Texas Department of State Health Services. the Texas Department of State Health Services actually has a workbook that you can work from and use that as a model. The Center for Disease Control and Prevention also has models available, and then Action for Healthy Kids has been a great resource for us as well. Last slide. And so if you have any questions, here's my contact information. Also, we have examples of this material on our website here at Leander ISD. Thank you.
Now I have to unmute me. Thank you, Ray. We have quite a few questions here, so I'm gonna start with a couple from Ray's presentation, and then we're gonna do a couple for each speaker and go through as many as we have time for. Who is in a campus wellness team?
Campus wellness team would have you would have the wellness champion. So at the elementary school, it's going to be our PE teacher. We'll have a parent. In a lot of our schools, we have our Texas PTA or our PTA Healthy Lifestyles Chair. We have our nutrition specialist on campus, which is usually our cafeteria manager. And that is the minimal amount of the wellness team. We also like to include administrator, school nurse, and a guidance counselor and classroom teacher.
Okay. Someone has a question about how you use SNAP Ed. Did someone bring that up as part of your coordinated school health program? Or is that just a general? That may just be a general question to any of you.
I didn't address that, and for the most part, when I look at the qualifications, we don't necessarily have as many schools that qualify for that. But I do know that if you go to Active Life website in Texas, Austin, Texas, you can find out a lot of information about the SNAP Ed program.
Okay. This one's for Kathy. Are your voluntary screenings for staff free, especially the lab work?
That's a great question. The screenings would be at no charge, and the lab work we might possibly have to refer that lab work out to a physician or county health department. I really am not sure about that. That's a great question, and I'm going to ask our team about that.
Okay. For Rebecca, what criteria or background do you require to become a coordinated school health coordinator? And Rebecca, hold on just a minute. I think, there you go. Now you're unmuted.
That's an excellent question. Our coordinators, they have to have a bachelor's degree, and we ask that they have a background from one of the 8 components in the coordinated school health model. And again, that works beautifully because when a new coordinator is hired, if you've got a background in physical education, we ask that you start with that area first and then branch out to the other ones. But they just have to have a background. They have to have a bachelor's degree, at least a bachelor's and a background in one of the 8 components.
Okay. Kathy, does certification include any funding for coordinated school health through the state? And another question that was similar to that is, where do the dollars come from for the incentive grants? So
that is from the TSET, Tobacco Settlement Endowment Trust. That is where the funding comes from. And those are the tobacco funds that our state received. And that's what is used to incentivize the school districts. As far as funding for coordinated school health, that's probably one reason we have not been able to get a mandate passed, because of dollars. And so I don't see that happening this year, next year in the legislature. I think probably the closest we're going to come to a coordinated school health program is the promotion of the current certification program. And that program doesn't really cost anything. We operate the program out of the state health department, and it's just one of our many health promotion programs.
Rebecca, along that lines, are all the schools continued to be funding for coordinated school health?
Yes, and it's the what how we did that is that when it went into law, and it's law that each school has to have a coordinator, and every school district has to follow the coordinated school health model. They did not have to take the funding, but obviously all of them did because they were required to do it all anyway, and they didn't want to pay it out of their own pocket, which makes sense. What each school system did, all 136 wrote a grant application to the state with all the requirements they were going to have to cover and an estimated cost, and the state worked with each school district to adjust those costs. They've gotten the exact same amount since 2006.
Okay. Another one for Rebecca. Is there anywhere to get the statistics or a journal article showing Tennessee improvement in academics associated with your strong coordinated school health program?
You can go on our website. Anything that we've got is on our website. We're hoping to really look. That's one of the things that we're working towards now, is really partnering with some of our universities now to actually write journal articles. We don't write them, I mean, here at the state, but we're hoping to really, we're just now being able, since we're in, going into the year of implementation, that we can really see these changes. I think you're going to see the research articles coming out here really soon, but the few that have been written in Ed Leadership and places like that, you can get on our website.
Okay. Ray, do you know, is the campus improvement plan mandatory for charter schools?
Good question. I don't know if they have to do that. I know all schools that are publicly funded have to do that, and but I wouldn't know about charter schools.
Okay. This is a general, I guess anybody can answer this. How does or could First Lady Obama's recently announced Let's Move active schools fit into successful coordinated school health models?
Hey, this is Rebecca, and we're going with it like gangbusters. It's fantastic. Again, because the Alliance for Healthier Generation, the Let's Move campaign. What we do is we send that out to our coordinators, and it's such a great program and plethora of resources that they're just going with it in all districts like crazy.
Anyone else using any of the Let's Move materials and information? Okay. Is Tennessee guiding school health coordinators regarding evidence-based resources to use, or do schools review programming or choose whatever they want for health and wellness initiatives?
These questions are fantastic. Absolutely. We are working very, very closely with Dr. Charles Bash, and he is one of the leading resources in, and we're focusing on, because it can be very overwhelming right now, we are truly focusing on the top 7 educationally relevant health factors that affect kids in school and affect their health, and connecting the health and academics. So he's the leader on the research on that, and we have actually brought him in as a consultant to help us with our evaluation and the training of our coordinators in all of our school districts with that research.
Is there, Ray, what is there used in Texas as far as curriculum or resources for coordinated school health?
Well, I was going to say, and I'll echo the research done by Dr. Bash. Really, if a school district's looking for how to close the achievement gap for children, he brings up some great points about how coordinated school health and health and wellness for the whole child is going to be important to closing those gaps. So I know our district's been looking at his research as well. The University of Texas in Austin Health Science Center has done extensive research on programs linking of evidence-based coordinated school health program, and that program was the CATCH program. Coordinated approach to child health, and if you go to their website, if you just go on and search for texascatch.org, you can find out a lot of information about them. There were 4 there were 4 programs that were recommended by TEA on the onset, and now we're down to 3. So if you go to the TEA website, you can find out what the other 2 are. And in Leander ISD, we use the CATCH program.
Here's a comment from one of our attendees regarding Let's Move. Let's Move in Schools focuses on physical activity assessment and implementation, and there is a toolkit for superintendents and principals. The CSPAP model is being used. So that might be helpful. And then Rebecca, this may have related to a previous question. Does this include public and private schools?
It's public schools.
Public schools.
And only if private schools are covered with state funding, but it's primarily our public schools.
Okay. This question can go to any of you. How have you incorporated parent involvement in these initiatives?
I can tell you what we're working on right now in Texas. We're working with our PTA, Texas PTA, which is our state organization program. They've endorsed a program called Healthy Lifestyles, and through that program, they have worked on a piece called the coordinated Texas or the Healthy Lifestyles chair position for any of the executive councils on district or at the school level, and it's a really good resource. If you go to texaspta.org, you can find out more information. But we're right now piloting a program within our district of putting a healthy lifestyles chair at each one of our schools and doing training. And those, what we found is they're a great resource of getting parents involved in the healthy lifestyles piece. Also, adding them to your wellness team, your shack. Those are great places to include parents. And then in our district, we have 23 elementary schools, and many of our schools have running clubs that are run strictly by parents. So there's a lot of different ways that you can include your parents.
Yeah, and in Tennessee, we just keep our coordinators updated on all the best practice as far as any programs to engage parents, and then they coordinate those based on the needs of their school districts. And the parents and student partnerships are required to be emphasized in coordinated school health in all the school districts. And last year alone, our coordinators directly partnered with over or right at 33,000 parents to work on addressing school health priorities.
And as far as the Certified Healthy Schools application, we have parents on our advisory board, and then we have a group of expert advisors that really represent all kinds of groups, teachers and parents and business and health and education. So we have a pretty rounded out field of people who are contributing and have contributed to the application. And in fact, on our advisory board, we have the Oklahoma PTA president, and that's great because she certainly has her finger on the pulse of our parents.
Okay, can someone spell the name of the Dr. Charles? Is it his last name?
Bosch.
B-A.
U-S-C-H.
It's B-A-U-S-C-H.
Yeah, and y'all, he has got a wonderful supplement that came out in the Journal of School Health with nothing but his research articles in it. It's fantastic.
Okay. So if they go to what website? His website or the Journal of School Health?
Yeah, Journal of School Health.
Okay.
Yeah, he was the keynote at ASHA in Kentucky a couple years ago.
Awesome. Yes, we will notify you by email when the videos and the slides are posted. And run through here. I'm jumping back and forth now. I'm not sure I covered everybody. So we will send a link out along with the evaluations. I think that's most of the questions. If I didn't answer your questions, you can send them to msmith@texashealthinstitute.org, and I will share them with our speakers. Thank all 3 of you for sharing your talents and your experiences with us today. I hope that everyone found value in this. I always learn something new from somebody every time I experience one of these webinars. So I'm excited about the progress that's being made, and I'll tell you that we have a very strong schools group. If you're interested in joining, let me know. There's a lot of good work going on everywhere from Louisiana to Florida, and we'll be doing some additional webinars with some of our other states sharing what they're doing in coordinated school health so that we can all learn and take advantage of what's been happening in the different states. Thank you all for your time today. We appreciate it, and I hope you have a great holiday weekend. This concludes the webinar.